When I discuss with patients lumpectomy versus mastectomy, patients typically want to know from me a whole bunch of things. But one of the things that they ask me is, well, gee, Dr. Harness, how often after a lumpectomy do you have to operate a second or third time because the edges or the margins are positive with breast cancer? It's a really good question. And earlier here at Breast Cancer Answers, we did a wonderful summary of a major study printed in the Journal of the American Medical Association in February of 2012. Now, here in July of 2012 comes another article from the British Medical Journal, I have it right here, dealing with this subject about, you know, after a lumpectomy, how common is it that you would need another operation or perhaps even an additional operation after that? The results from this retrospective study published by the British is actually quite similar to the one published here in the United States. If you take both invasive breast cancer and in situ breast cancer, and then look at the odds of having to go back for another operation, in the aggregate, it's about 20%. But some really interesting things have come out of this study, and one of them is, and it, by the way, parallels my experience, one of them is that there's a difference in the reoperation rate with the in situ breast cancers that are inside the ducts and going up the tree, so to speak, or the branches of the duct, and versus the invasive cancer that's growing out through the walls of the duct. Typically, the invasive cancers are a little more well localized, if you will, and there can often be around the edge of the invasive cancer some in situ breast cancer. So you're looking at this study, the overall incidence is in the neighborhood of 20% for both kinds of cancers that you have to operate at least a second time. But interestingly, it's only about 18% for women who have invasive breast cancer versus nearly 30% for women who have in situ breast cancer. And frankly, this parallels sort of my clinical experience as well. With the in situ breast cancer, it's like trying to chase salt around, little specks of cancer. And this is not anything we can feel at the time of operation. There's no good way at the time of surgery to microscopically evaluate the margins. So that's probably one of the reasons why with the in situ breast cancers, that the odds that you're going to have to go back a second time or even a third time go up. With the invasive breast cancers, usually we can feel them. We can use ultrasound at the time of surgery to even better localize or evaluate the margins, so that in my own experience with just the invasive cancers, the incidence of having to go back for a second or third time is lower. One of the dilemmas in lumpectomy is we're always trying to take out the right amount so that we don't have cancer at the edges or at the margins, yet on the other hand, trying to save breast tissue so that we have it for our oncoplastic reconstruction. What's the bottom line of this? If you're somebody or know somebody that needs a lumpectomy, you should be talking with your surgeon about what his or her incidence of reoperation is, what they try and do at the time of surgery to minimize that, but fully understand, please, that with breast conservation, with lumpectomy, probably in the aggregate in the United States and now from the British literature, probably looking between 15 to 20% of the time, you may have to go back for another operation. Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
About personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.